Medical professionals of Reddit. When was someone's self-diagnosis surprisingly accurate? Saw someone she had a runny nose and was insistent that her cerebrospinal fluid, the fluid that surrounds your brain, was leaking through her nose and causing her to have a runny nose. This is usually pretty unlikely, especially without a history of trauma. Order a CT of her head, but doesn't show anything and she otherwise looks fine, so she's sent home. She comes back the next day with a jar of this fluid she had collected, saying this isn't not, ran some more tests and turned out she was right. I'm glad she was persistent. Poor woman's husband drags her to her repeatedly for weeks on end with a bizarre variety of neurological symptoms. She'd seen a neurologist and was told it was all functional. MRI showed a rapidly growing brain tumor. She was having seizures. Her husband was 100% right. Just the other week, had a 60-year-old guy, reeking of cigarettes, come in for upper endoscopy, camera to look at the esophagus, stomach and part of the small bowel. He was describing food getting stuck mid-swallow in the middle of his chest. I think it's esophagus cancer, he said. I was thinking that too, but didn't say anything. Sure enough, that's exactly what it was. Obligatory, not a medical professional, but I have a funny story about self-diagnosis from when I was in a motorcycle accident. It was a head-on collision and I had gone over the hood and windshield of the car that hit me and skidded through an intersection. Was wearing a helmet, boots, leather jacket. I absolutely had a massive concussion but wasn't aware of it at the time. I was not in pain. I felt disoriented and insanely thirsty, but no pain. I sat up and took off my helmet and there was a crowd of bystanders trying to get me to lay down, but I just wanted to go home. The thing is, no matter how many times I tried, I could not actually stand. When the EMTs arrived, I was sitting upright on the ground, and I helpfully informed them that I thought my leg might be broken, because I had tried to stand and found it was not weight bearing. One of the EMTs scoffed and said something like, "You think or no crap." I very sincerely insisted my leg might be broken, at which point he got serious and asked me if I had actually looked at my leg or not. I hadn't thought to do that. Bear in mind I had one heck of a concussion. I looked down, and there was my bone sticking out from my skin and through the denim of my jeans. There was blood everywhere. "Oh," I said. "Yes, your leg is definitely broken," said the EMT gently. "Well," I said, reasonably, "I mean, how do we know yet? I mean, we should probably get an X-ray. Shock is a hell of a drug." When trauma patients say, "Am I going to die?" right before they lapse into unconsciousness or get tubed for surgery, they are usually right, and they know it. Hidradenitis suppurativa, recurrent severe skin abscesses. She came in saying that she was worried she had it because she's had some abscesses in her armpit. 9 times out of 10 it's because of shaving with a dirty razor, which is what I told her. I'll be damned if she was right. Ended up having 5+ abscesses that formed tracts requiring surgery. They recurred a few months later. Sent to dermatology who confirmed the diagnosis. Worked in the ER when a lady ran in screaming that her husband was dead in the car. Staff walked out to see. I asked if they should hurry and they said no because people exaggerate those things. Turns out dude was dead. Based on the smell and bloating. Had been for 3 or 4 days. She was a junkie and was living in the car for days before she noticed he had odd. I mean, technically they still didn't have to hurry. When I worked as a camp counselor, I woke up one morning with severe joint pain. I'd slept on the ground the night before, so I chalked it up to that. When it didn't go away after a couple days, I went to the camp nurse who diagnosed me with dehydration. After downing a 12-pack of Powerade, I'm still surprised I didn't pee blue. I still had the joint pain. A bunch of the other counselors were convinced that it was stress or that the fluid in my joints had dried up. Then I went and did the one thing you should never do. I logged onto WebMD and searched my symptoms. And right after cancer was Lyme disease. It made a lot of sense, but I'd never had any rash or notice any tick on me. So I went back to the camp nurse and she had me leave camp to get a blood test, and I ended up going into the ER because there wasn't a clinic available. The nurse gave me a shot in the ass for the pain. Drew my blood, and an antibiotic on an empty stomach just in case. Turns out I was allergic to the antibiotic, so I got hives and I threw it up. I received a call the next day that yes, I did have Lyme disease. Dried up joints, my ass. I don't remember a single person who claimed they had a kidney stone who was wrong. The only person I ever had who didn't have a kidney stone unfortunately had a ruptured ectopic pregnancy. I diagnosed myself with an adrenal tumor. My primary care doc kept telling me my symptoms were caused by lifestyle choices. I went to my gyn who took me seriously when I showed him my research. It was a cancerous bioactive adrenal tumor the size of a grapefruit. That was over 2 years ago and I'm still fighting this cancer. I developed either recurrence or mets a few months after my initial surgery and I've been dealing with liver and lung mets ever since. I won the argument with my primary care doc but my prize was cancer. Sad trombone. Not nearly as dramatic, but apparently scabies, literal heck on earth, is hard to diagnose. I noticed the symptoms pretty quickly and thought my childhood eczema had come back to haunt me. When treatment for that only seemed to make it worse, I figured out that it had to be scabies. All the normal problem areas, itchy at night, etc. The problem was, I couldn't get the lotion to treat it without a doctor signing off. I went to the doctor and she immediately starts diagnosing me with everything besides scabies while I'm telling her multiple times that it's most definitely scabies. I went 3-4 times and the last time I left when she refused to allow me to get the treatment cream and wanted to say I had allergies instead. I told her I was not putting up with this torture while she keeps taking my money and misdiagnosing me and she goes, well, I'm sorry, you aren't getting scabies treatment without a doctor's note. And I really don't think you have scabies. Apparently she never heard of Amazon. I went home, ordered Permethrin 10% off Amazon, mixed it with a thick lotion and crap cleared right up. I was so tempted to call her and let her know, but she probably would have said one of her earlier attempts at treatment finally worked. Not a doctor but a patient. Had pancreatitis a few years ago, around 2014. Always had stomach problems, but no idea why until that day. 2 years later, in 2016, I had the same terrible pain. Tried to wait it out for 5 or so days, but broke down and went to the ER. I said I think I have pancreatitis, was treated like a drug-seeking alcoholic, and I stopped drinking in 2014 because of the pancreatitis. Doctor tried to tell me it was indigestion. When I asked why I was in constant pain even when I haven't eaten in 3 days was when the doctor completely changed her attitude and pretty much told me we're not going to help you. About 3 months later my lipase levels were high enough to be considered an attack, so I was admitted and was diagnosed with chronic pancreatitis, not alcohol related. I still think about that doctor and it makes me so angry. I wonder if my life could have been a little better if they took me seriously and found it out sooner. 2017 has been rough. I'm not medic but one of my co-workers is. His best story. Once a woman came to hospital to prove herself diagnosed diabetic. Blood test proved it. Doctor asked how did she know it? She answered that her urine is too sticky. After hurting my knee and having to ice it all the time, I found I kept breaking out in hives after the ice. I went to the doctor and told him I thought I had cold-induced urticaria, allergic to cold. My parents scoffed at it. The doctor had never had a patient with this so it was dismissed. After it kept happening to me I got them to send me to an allergist. My parents thought I was crazy until the doctor confirmed my diagnosis and handed my parents information on anaphylaxis. But at least now I get a handicapped parking pass in the winter and don't have to shovel the walk. Patient not doc, but I was almost as amazed as my PCP when I was right so I'll share. My dad had been diagnosed with AFib and an arrhythmia a year prior. He was told that most people are not diagnosed until they have a problem. My dad took me and my kids to the science center where they had an exhibit all about the human body. There is a section all about the heart. They had several things that would monitor your heart rate, including a drum that would beat along with your heart when you touched sensors. Everyone else had nice steady heartbeats show up on all of the little things that they had, but mine kept acting funny and so did my dad's. The thing was I didn't have any symptoms and I felt perfectly normal so I didn't think that it would actually mean anything. It's basically a toy, right? I told myself I'd feel dumb if I didn't mention it to my doctor in case there was a link. When I suggested that I thought I had arrhythmia because the science center gadget didn't pick up my heart rate the same as everybody else, my doctor looked at me a little funny, but ran the tests. Sure enough they found it and did a few more tests to establish a baseline for comparison later on in life. I went to my doctor because I thought I had appendicitis. He agreed and sent me to the hospital. They ran tests, Said I was fine and should go home. I refused. Called my doctor, who called them and made them run the tests with someone who knew what they were doing. They came back to me and had me in surgery within 2 hours. I had a dude come in the other night and tell us he thinks he was shot. He absolutely nailed that one, but in all seriousness it was GSW to the head and the MRI was gnarly. My side of the story, but when I was a kid I felt real ill but didn't really have any symptoms. I just felt ill. My mum just thought I was trying to wag school and the doctors felt the same. They started to get really mad at me cause I was so ill for ages and kept crying at school and have to be picked up. Fast forward 2 months or so and my dad was bathing me. I was like 6 and saw these weird spots and bruises on my legs. Took me to R&D and after another couple weeks the tests came back and I had a rare form of leukemia and was super sick. Had almost 2 years off school and my brother had to donate me his bone marrow to survive. It was brutal. Can't remember much though apart from the chemo turning my pee blue. My stepfather is a doctor and told me 2 stories. One was an older Irish woman who correctly predicted that she had a tumor in her left lung roughly the size of a golf ball. She has never smoked or done anything that made her a risk, but she insisted her very mild cough was the result of a large tumor and demanded to have it checked out. She was dead on and claimed she saw a person on TV with the same symptoms, and when she fell asleep her dead husband in her dream told her to go to the doctor and here she was. The second was a guy who said he felt like he was stabbed and thought something went wrong with his surgery when they removed a cyst from his lung. He was half right. The surgery went fine but he had a thin strip of metal shish kebabbing him through the chest because he apparently plopped onto his bed without removing some junk including a large 6-inch receipt spike. His bandages covered up the new wound. In other words, it felt like he was stabbed because he was stabbed. Not a medical professional, but 4th grade me, mid 1990s, had a terrible shooting pain in my stomach. It got to the point where I couldn't walk. The doctor told me on the first visit it was probably a stomach virus and gave me some meds. I was staying home from school due to the pain and was watching Full House, and Jesse had to go to the hospital and get his appendix removed. I was so freaked out I made my parents take me back to the doctor the next day. I was crying and told the doc I think I had appendicitis. He did some checks and confirmed it. Surgery same day. After surgery they told me if it waited another few days it would have burst. Full House may have saved my life. I caught whooping cough, border telepertussis, and literally begged the doctors to run tests. Weeks and weeks passed and they just told me it wasn't whooping cough, but I was catching back-to-back flu colds bronchitis. Girlfriend also caught it and we again begged them to run tests, to which they told us they don't want us because by now they can't treat us anyways, so it made no difference. I explained that as they told me it was just a cold. I'd been going to work for weeks, well sick. I hate this too, but I wanted to keep my job so I went, and 2 colleagues have newborns, so it would be good to warn them in case they catch it off me. They ran the tests and diagnosed us, but such a pain in the ass. I watched the episode of Grey's Anatomy where there was a patient with severe migraines and Eric Shepherd can't figure out where his pain is coming from. Mark Sloan comes in, looks at him and shoves a pencil up his nose, diagnosing him with a deviated septum. For years I had suffered with migraines and headaches and recently stopped breathing fully out of one side of my nose. Stuck my finger up, felt bone, went to the doctor a few days later. My general doctor didn't believe me. I went to an ent and told him what I thought was wrong, and by golly I was right. Severely deviated septum. Had surgery a few weeks later. My wife's OB-GYN was out of the country when she started to go into labor. Her blood pressure had been high but we were monitoring it. In the hospital it was through the roof. I looked at her chart, researched everything online and told the doctor on call that she has HELLP. He ignored me, said it was fine. When the delivery was almost done her blood pressure dropped to nothing. A nurse shot her up with something, because the doctor was busy eating lunch, and she recovered, but I will never forget holding my wife's hand thinking that this might be the last time I see her alive. When her OB-GYN got back to town she confirmed the diagnosis I gave independently. We live in a small town. The doctor avoids me. Once while I was working as an EMT, we ran a call for a guy who had gotten smashed and fell flat on his face on the sidewalk outside his apartment, cutting open his forehead. At the hospital, he was told he would be breathalyzed to obtain a back and loudly proclaimed, "I'm feeling .308. He promptly blew a .308 and the whole team applauded. My gran was having chest pains and thought she was either having a heart attack or indigestion from a pastrami sandwich. So she went to the doctor. While she was there, her BP was 210/90. The doctor said that she was obviously having indigestion and that the pain she was having was gas pockets, and prescribed her an antacid and a higher dose blood pressure medication than she was already taking. She took it and her pressure bottomed out. I took her to the hospital and found out she had been having a heart attack for the past 2 days. She died that night. I'm still bitter 18 years later. The worst part is no lawyer would take the case against him because she was old and was going to die sooner anyhow. My son came home from Iraq with a weird skin lesion that the army doctors diagnosed as psoriasis. I didn't buy it. I did some research online and suspected it was leishmaniasis, an infection transmitted via sand fleas. I took him to a private dermatologist and presented my research. The dermatologist sent a biopsy to the CDC and got the official diagnosis. The army still insisted on labeling it a non-specific skin irritation. They didn't want to pay for the expensive drug regime. I hired a lawyer. The army gave in and paid for the treatment. Sure, it cost us about the same to push them into it as if we just paid out of pocket, but it was worth it to force them to put the proper diagnosis into my son's records. I correctly self-diagnosed a blood clot in my leg. I went to the ER with excruciating pain in my calf and told the doctor that I suspected a blood clot. The doctor assured me that I was young and healthy and I wasn't at risk for a blood clot. He diagnosed it as a pulled muscle, offered me some painkillers and sent me home. Fast forward 2 or 3 weeks, I still had excruciating pain in my calf, and I started to develop severe shortness of breath. I went to the urgent care clinic this time. The doctor at the urgent care clinic immediately suspected a blood clot and sent me to the ER for some tests. The ER doctor did an ultrasound on my leg, declared that I didn't have a blood clot, and sent me home. The next morning, someone from the ER called me and sheepishly admitted that they had misread the test the night before, and I did in fact have a blood clot. It turned out that I had had a blood clot in my leg all along, and the clot had broken off and traveled to my lungs. Thankfully, I've made a full recovery, despite nearly being killed by the incompetence of multiple doctors. You have been visited by the Be Humble, Be Stay Humble and Believe in Yourself. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.